Good afternoon, thank you very much for joining us. Let me give the usual statistical update to begin with today. An additional 29 positive cases were confirmed yesterday. That represents 0.8% of the people who were newly tested yesterday and takes the total number of cases in Scotland now to 19,027. A full Health Board breakdown will be available later on. But the provisional information we have is that 18 of those 29 cases are in the Grampian Health Board area. It's not yet clear how many are connected to the ongoing outbreak in Aberdeen, and I'll say a little bit more about the situation there shortly. A total of 267 patients are currently in hospital with confirmed COVID. That's 6 more than yesterday, and 3 people are in intensive care, and that is the same as yesterday. I'm also very pleased to say that yet again in the past 24 hours no deaths were registered of patients who tested positive over the previous 28 days, and therefore the number of deaths under that measurement remains 2,491. Obviously though, the total number of deaths still reminds us every single day of the dreadful impact of COVID, and my condolences again go to everyone who has suffered loss. And as always, I want to thank everyone who is working hard to help the country through this pandemic. I have 2 things I want to update on today. The first is the current situation in Aberdeen, and then I want to say a bit about the reopening of schools from tomorrow. Now, I've just mentioned that in the past 24 hours, 18 new cases were confirmed in the Grampian Health Board area. That means in the 15 days since the 26th of July, a total of 231 cases in Grampian have been identified. We understand that 157 of those are linked in some way to the Aberdeen cluster, and a total of 852 contacts have now been identified from those 157 cases. Now, it's important to stress that those 852 contacts might not equate exactly to 852 people. There is likely to be some overlap between different cases. But that figure helps to give some idea, I think, of the scale of the tracing exercise which is underway in Aberdeen. The majority of those contacts have already been traced, and tracing procedures are in place for the others. And that in itself shows how hard and well our Test and Protect teams are working, even in relation to a large and complex cluster. In addition, I hope that the measures that we put in place in Aberdeen last week will help to slow and then stop transmission before it becomes widespread within the community. And the advice we've put in place about not travelling to or from Aberdeen unless absolutely essential should reduce the risk of cases spreading from Aberdeen to other parts of Scotland. That said, we do expect the number of cases and contacts in the Aberdeen cluster to rise further in the days ahead. But I want to take the opportunity again to thank all those working hard locally to seek to contain this cluster as quickly and as effectively as possible. And more generally, the events of the past fortnight have been a reminder of how fragile Scotland's overall position is, and that is the same in countries across the world. We have seen, and we are still seeing, thankfully, low rates of transmission in most parts of the country. But we've also seen in Aberdeen just how quickly that can change. It can literally change in an instant. And it will change if we drop our guard. So for that reason, whenever you are out and about, please continue to think about your own actions, not just in Aberdeen, but wherever you happen to be in the country. Let me remind you that no more than 3 households should be meeting together indoors at any one time, in each other's homes, and in places like bars and restaurants. It's important to recognise that that household limit applies in places like bars and restaurants just as it does in your own home. And people from different households should be staying physically distant from each other at all times. And again, that's something we advise strongly if you're in a bar, just as we do if you are meeting other households in your own house. And each of us should be thinking about our recent behaviour, and all of us asking ourselves the question, have we been a bit more relaxed about things like physical distancing when we've been meeting up with friends recently? Are we creating more bridges that allow this virus to spread, to travel from us to another household or from another household to us? Because if we are doing that, and I think it is inevitable that many of us will have dropped our guard that little bit, then now's the time to recognise it and try to rectify it. Because the fact is we all still need to be really careful right now, and Aberdeen is very hard proof of that fact. Nobody's life, while our lives have regained a bit of normality in recent weeks, nobody's life should be feeling absolutely normal at the moment. COVID is still present and we know it's still highly infectious. So all of us have a big role to play in trying to keep it under control. And one reason why that is so important, why suppressing and hopefully eliminating the virus is so important, is that it is the best way of ensuring that schools can reopen and then stay open safely. That has to be a priority for all of us, and it is very much a priority for government. Earlier this morning, I visited West Calder High School in West Lothian to see for myself the preparations that they are making for reopening this week. Like many schools across the country, they are having a phased return. Tomorrow is an in-service day for staff. Wednesday is for students in secondary school years 1 to 3, and Thursday is for students in year 1 and years 4 to 6. And then from Friday, all students will be in school full time. And I think it is worth saying that for students and staff, school will feel different to how it was before. There will, for example, be a lot more hand washing. Some schools will have staggered starts and lunch breaks. At West Calder, for example, school lunches have to be ordered on an app in the morning and collected at lunchtime. And for staff, while young people are not required to keep 2 metres apart within schools, teachers and other adult staff do need to keep that distance. Now, I know that there will be nerves and anxiety for children, parents and teachers this week, and I think that is entirely understandable. Hopefully, induction days that I know are happening in many schools will help young people to get used to the changes and to being around each other again. But fundamentally, all of us know that the reopening of schools is essential for children's education, personal development, indeed I think for their general well-being and happiness. So what we are doing is trying to ensure that the reopening is safe and effective. I was really impressed and reassured this morning by what I saw of the preparations at West Calder, and I know these preparations are being repeated in schools right across the country, and I'm very grateful to everyone, teachers, teaching assistants, local authority workers and all school staff who are enabling schools to safely reopen. There are 3 other quick points I just want to make in relation to schools. The first is that although schools can reopen from tomorrow, this reopening doesn't yet apply to unregulated indoor activities for school children. For example, some indoor play or activity clubs and some faith-related education such as Sunday schools and madrasas. They should not start again until agreed guidance is in place. The second point is about travel. We know that the reopening of schools will put extra pressure on public transport and on our road network. So Transport Scotland is today launching a Travel Safe campaign. It asks commuters to help the transport system by only travelling if you need to and by working at home when you can. But if you do need to travel, please walk, cycle or wheel to work whenever that is possible. And if you need to use public transport or if you need to drive, which will be the case for some people, think about whether you could make your journey outside of the peak times. The continued need for physical distancing on public transport as schools reopen and as more business activities resume will put more pressure on transport services. So the Travel Safe campaign is intended to help you think about ways in which you can help with that. Now, the final point I want to cover today is for those pupils and indeed parents of pupils who received their SQA results last week. John Swinney will make a statement in Parliament tomorrow about the steps we intend to take to address concerns about this year's results. And at the heart of that, we will be taking steps to ensure that every young person gets a grade that recognises the work they have done. Let me be clear about this. In a very difficult and unprecedented situation, we took decisions that we thought on balance were the right ones, and we took them with the very best of intentions. These were broadly the same decisions that have been reached for England and Wales as well. But our concern, which was to make sure that the grades young people got were as valid as those they would have got in any other year, perhaps led us to think too much about the overall system and not enough about the individual pupil. And that has meant that too many students feel that they've lost out on grades that they should have had, and also that has happened as a result, not of anything they've done, but because of a statistical model or an algorithm. And in addition, that burden has not fallen equally across our society. So despite our best intentions, I do acknowledge that we did not get this right, and I'm sorry for that. But instead of doing what politicians sometimes do and dig our heels in, we are determined to acknowledge that and to put it right. There are, of course, deeper questions that we will need to resolve for the longer term about the impact of exams on the attainment gap and on the difference between exams and teacher judgment. But the most immediate challenge is to resolve the grades awarded to pupils this year. As I've said, we will set out our approach tomorrow to the Scottish Parliament, but let me be clear that we will not expect every student who has been downgraded to appeal. This situation is not the fault of students, and so it should not be on students to fix it. That's on us, and we will set out tomorrow exactly how we intend to do that. These are the two main issues I wanted to cover today. Obviously, we'll talk a lot more about both of these issues and no doubt others as the week progresses. Before I hand over first to the Health Secretary and then to the Chief Medical Officer, let me just close by reminding everyone again of facts, the 5 rules that we all must follow to stay as safe as possible. Face coverings in enclosed spaces, avoid crowded places, clean your hands and hard surfaces regularly, 2 metres distancing remains the overall rule, and self-isolate and book a test if you have symptoms. If we all comply with these 5 golden rules, then we will collectively reduce the risk of this virus spreading. So I encourage everybody to do that and to do that rigorously, because it is in the interests of all of us individually, in the interests of our families, but also in the interests of the country as a whole. Thank you very much for listening. I'm going to hand over now to the Health Secretary and then the Chief Medical Officer, and then, as always, we will take questions from the media. Jeane.
Thank you very much, First Minister. I want to touch briefly on the next steps for care home visiting, which we announced over the weekend. Outdoor visiting, which has been in place for 1 visitor since the beginning of July, can, from today, be extended to up to 3 visitors from no more than 2 households. The safeguards and conditions that must be met for this to happen are that the home concerned must be COVID-free for 28 days. There must be a risk assessment and protocol in place that has been agreed and approved by the local health protection team. The home must be fully participating in the weekly care home staff testing programme, and from this week, they must also be fully participating in using the care home safety huddle tool, designed to ensure that homes have all the staffing and the rota and the other measures in place that we know they need to. Of course, at this point, and regrettably, but importantly, none of this applies to care homes in Aberdeen City, where visiting remains prohibited except in exceptional circumstances such as end of life. I also want to introduce indoor visiting for residents by 1 designated visitor, and to do that, homes, as well as meeting the criteria I've just set out, will need to develop a clear plan that carries a risk assessment, arrangements for staff availability and physical distancing, increased cleaning regimes. And that plan must be approved by the local Director of Public Health, who will also take account of the prevalence level of the virus in the local area. I hope that homes who meet the criteria will be able to complete those steps and receive the necessary approval, dependent, of course, on the prevalence of the virus by August the 24th. Finally, we are working towards reintroducing a range of healthcare services directly to homes that were there before the pandemic, services like podiatry, eye care, dentistry that have been, by and large, provided at a distance up until now. And also the opportunity for residents who, before the pandemic, were regularly leaving the care home to visit family and friends. All of that, I know you understand, requires really careful consideration to ensure that we do it in as safe a way as possible and balance The benefit, of course, to residents with the risk of contracting the virus. So the work is underway to take specialist advice on the critical safety measures and requirements that would allow us to do this and to do it as safely as we can. And as we move towards that, I will, of course, keep everyone involved updated. I know this has been and remains a very difficult time for residents in our care homes and for their relatives and, of course, for the staff. And I'm very grateful to everyone for their patience and their hard work in all of this. I want to see as great a return to normality as we can manage, but we must do it very safely. And I know everyone appreciates that.
Thanks, Jeane. And Gregor.
Today I wanted to touch on one area I'm still concerned about, both as a GP and as the Chief Medical Officer. We've said often through this pandemic that the NHS has been open for those who require it, and our urgent services have continued, with many others restarting as we've worked through phases 2 and 3 of the route map. Our primary care centres and GPs have continued to be available and have made a lot of changes in light of new COVID-19 risks to keep people as safe as possible. I want to thank my colleagues across primary care for the superb job they've done in providing this care. I still hear, however, from our GPs that they are not seeing some of the types of patients they would normally see. For a small number of people, symptoms of lung cancer may be developing unrecognised, and there are still fewer people seeking help for this than I would expect. This might be because the symptoms appear similar to COVID-19, or because people are uneasy about seeking help or bothering services. My message is please don't ignore this. Contacting your GP, being assessed and treated when this is required, and as soon as possible, all hugely improve your chances of a good outcome. If you or someone you know has been experiencing a persistent cough, unexplained weight loss, or continued shortness of breath, please make sure you use your NHS and contact your GP or NHS 24. This is especially important if you have unusual symptoms like blood when you cough or unusual pain in your shoulders or chest when you breathe. To support GPs in decision-making when checking patients with symptoms similar to COVID-19, new urgent suspicion of lung cancer guidance has also been developed and is now published. This guidance has been sent to all health boards and provides a framework on the next steps GPs should take where patients present with specific symptoms. We hope this will help in making that difficult but hugely important differentiation between COVID-19 symptoms and those of potentially more serious conditions like lung cancer. It is, however, of a little comfort that since my statement in April, we have seen a significant increase in urgent suspicion referrals generally to almost pre-COVID-19 levels. We're now seeing the number of referrals at around 96% of what we might have expected pre-COVID-19. Throughout this pandemic, we have been clear that vital cancer treatments and emergency, maternity and urgent care continue, and our NHS boards have worked hard to ensure vital cancer care remains accessible. Some patients may have seen changes to their treatment plans to manage and minimise their individual risk. These decisions will not have been taken lightly, and any decision will have been guided by both the clinical evidence and clinical risk and discussed between patient and clinician carefully. So again, if you or someone you know has been experiencing a persistent cough for longer than anticipated, or continued shortness of breath, or you just have symptoms that you're concerned about, please make sure you use your NHS and contact your GP or NHS 24. The sooner you get these checked out, the better.
Thanks, Gregor. I'll move on to questions now. Glenn Campbell from BBC.
First Minister, I know we get the details tomorrow, but can you give us a little more today? Does your announcement mean that the system of moderation will no longer apply? Will students get the grades that teachers said they were worth? And do you still have confidence in John Swinney as your Education Secretary?
Yes, I do, and I'll perhaps come back to that briefly later on, but if you don't mind, I want to focus today on the substance of the issue and rectifying the situation for young people. That's the most important thing for me, and it's the most important thing for John Swinney as well. For reasons you'll understand, Glenn, I know you'll understand in particular as a journalist, I'm not going to go into the detail today because we will set that out to Parliament as is appropriate tomorrow. But what I've said today is we want to address this, and we will address this in a way that means young people get the grades that they feel they have worked for and earned. And secondly, we will not put the onus of that on young people. We're the ones that, with the best of intentions and in a difficult situation where there was no clear right way and wrong way to do this, we accept we didn't get this right, and therefore the onus will be on government to fix this. And we'll set out the detail of exactly how that will happen tomorrow. And I won't go into any more detail of that right now. I don't want to focus on the politics of this. Obviously, Parliament can do that over the course of the week, and that is perfectly legitimate. I suppose I'd just make 2 points. Firstly is the one I've really alluded to already. There's no decision that governments anywhere, or very few decisions that governments anywhere have had to make in the past 5 months that have been easy or where it's been black and white. We're all making really tough decisions in circumstances that none of us want to be in, and are far from ideal. And we will not always get those right, and that's not because we don't try to get them right, but because we are in unprecedented circumstances. And I think it's really important, and I've said this all along, that when we do make a mistake or not get things right, then we're big enough to say that and not do what politicians, all of us in more normal times, tend to do, which is dig our heels in and defend things. This is a completely unprecedented situation. We're all trying to get through it as best we can, and where we think we've not got something right first time, I am not going to lead a government that isn't prepared to say so and try to get it right in future. And the other point I would make, which is, again, you know, it's not trying to be party political, because I don't think this is. And so what I'm effectively doing here is just illustrating that with the reality. Governments everywhere are grappling with these issues, and the approach that was taken to results in Scotland this year is broadly the same approach that is being taken in England and Wales as well. And I suppose the illustration of this not being party political is that in England that's a Conservative government, in Wales it's a Labour government, actually with a Liberal education minister. So we're all in the same boat here, and we're all trying to do the best things in difficult circumstances. I can't speak for other governments. Obviously, A-level results come out later this week. Scotland, because of our schedule of exams, have been the first to confront this. And we're saying we didn't get this right. I want to say again to young people, I'm sorry for that, because as I said, when results came out last week, this is a big moment in your lives, and I'm sorry that some of you have had this anxiety this week, but we're going to put it right for you, and that's the commitment I'm giving you today.
First Minister, Labour and others say the Education Secretary has failed and he should go. You say you have confidence in him. Why is he the right person to fix this mess?
Well, I believe he is, and you know, the point I've made, I would just ask people, and I'm talking to the public here, opposition parties will take the decisions they want to take. That is perfectly legitimate. We live in a parliamentary democracy. I've been an opposition politician in the past, so I'm not going to get into that here. These are debates for Parliament to have in the proper way. The point I've made, though, and I'm not going to repeat it at length, is that there are different governments in different parts of the UK, all led by different parties. And actually, they've all taken broadly the same decision. Now, it will be for other governments to decide whether they want to stick with that or as we are doing, decide to do something different. But this is not about a particular party or a particular government. This is about all of us trying to make difficult decisions as best we can. And from my part, because I only speak for my own government, and I'm only, obviously, I'm accountable for my own government. When we get things wrong, I want to be able to stand here and acknowledge that and put it right. Because I think fundamentally, particularly in this time of crisis, and maybe we can learn a bit for the future around this as well, I think that's better than simply digging our heels in and trying to defend a position that we think in our hearts, when we've had the opportunity to think about it and see the impact on young people, we didn't get right. And that's the approach I will take. It's the approach the Deputy First Minister is going to take, and I hope that's the one that young people affected and their families will see as the right approach to take. Louise Jose from STV.
Yes, thank you, and good afternoon. First Minister, over the weekend, are you satisfied that people in Scotland have been conforming to the rules? And looking towards Wednesday, how likely is it that the lockdown in Aberdeen will be lifted? And a second question, if I may. As Scotland began to unlock, some parts of the hospitality industry introduced 2-hour booking slots for food and drink. Now, whilst introduced with the best intentions, these slots meant that people who might be happy to stay in one place could continue socialising to a second or perhaps a third venue. Given the situation now, particularly in Aberdeen, would you welcome pubs and the industry perhaps reconsidering that approach?
I think all of these arrangements have to be kept under review on an ongoing basis, because we need to assess the impact they're having and whether they are having the desired effect to stop this virus spreading. I said on Friday, and we'll talk about this more later in the week, that we're going to introduce statutory guidance now for the hospitality industry, which will put some of what has been in guidance, give it a much stronger legal basis, and look at some of the ways in which we can best support the hospitality industry to stay open and to stay open safely. In relation to, you asked me, did I think over the weekend people have been complying? I think by and large, the majority of people are trying to comply. We're all trying to comply. This is not natural behaviour for any of us. But I think we're all finding it hard. And I speak from my own experience as an individual, but also from what I observe. I think some of what we're finding hardest, and I know this is true for me, is the physical distancing, because it just doesn't come naturally with people you know and love and people you're used to, being around. And so I think we just all have to make an even greater effort to do the right thing, however difficult it is, because I think we all know how important it is. There's always going to be a minority of people who perhaps more flagrantly breach the guidelines, and what I would say to them is just stop and think about the impact you're having on other people. This is a classic example of the difference between individual behaviour and collective behaviour. If you as an individual, take part in extreme dangerous sport where there's always a risk, apart from the emergency services, that risk is to you. Right now, if you're breaching the regulations, the risk is to everybody, because if you help to spread the virus, you don't know that it's not somebody really vulnerable that is going to be one of the people who get the virus because of the risk you have taken. So right now, and I'm aware it kind of sounds a bit, cliched sometimes, but it is really true. Everything we do right now impacts on everybody else potentially. So we have to, all of us, just stop and think about that individual responsibility we have to everybody around us. So that's my plea to everybody as we continue to try to navigate our way through this. And lastly, Louise, on the situation in Aberdeen, I'm not going to preempt the decision we will reach on Wednesday. We said we'd review the restrictions in Aberdeen on a 7-day basis, so we will do that on Wednesday. I would really just repeat what I said last Wednesday when we first introduced these restrictions. We won't keep them in place longer than we deem as necessary, because I don't want any part of the country to be living under these kind of restrictions. But having done it, we have to make sure we do it long enough to get the cluster and the outbreak under control. And so I can't rule out and won't rule out the possibility that we may have to extend for a further 7 days when we get to Wednesday. But I'll outline on Wednesday the conclusion we've reached once we've taken into account all of the evidence and data that we will consider as part of that decision. Peter McMahon from ITV Border.
Thank you, First Minister. First Minister, following on from what you said about exams there, do you now accept the judgment of the people who everyone agrees know the pupils best, and that is the teachers?
I've always trusted teachers. What I would say, I'm not going to go too much further or any further at all into the detail of what John Swinney will set out tomorrow, because it's important and right that is set out to Parliament. We asked the SQA to have a system of awarding qualifications to young people this year that recognised the work young people had done, obviously, but also made sure we had a set of results that were credible and maintained standards. And the SQA, and I should say, I don't attach any blame to the SQA for this. You know, this is Minister's responsibility. And the SQA have done that. But I think in looking at the whole system approach, we've perhaps not thought enough about the impact on individuals. And I, over the days since last week, have become more acutely aware of something I'm not prepared to countenance, which is the impact on a young person, particularly a young person in one of our most deprived communities. The conclusion they may be reaching right now is no matter how hard they work at school, no matter how seriously they take education, the system is stacked against them. And I'm not prepared to have that outcome. And I also understand that whatever the intentions, and you know, these were the best of intentions about the whole system, if you're an individual young person who now faces or who has faced the prospect of having to appeal, you feel as if that's nothing to do with you. Whether you ended up in the group of people whose teacher judgment was accepted without question, or in the group of people who's now going to have to justify it through an appeal, is down to an algorithm. And I accept the fact that that feels deeply unfair. So, you know, we've tried to balance difficult considerations here, and I suspect, you know, there will always be people who take one view or the other, but I'm not prepared as First Minister, I know the Deputy First Minister feels this as well, to have this year's cohort of pupils, particularly those from our more deprived communities, because this, you know, the danger is this leads into next year's cohort and the year after that, of thinking that their hard work at school doesn't count if the system is determined to be against them. So there is a bigger issue here than the one we initially tasked the SQA with, that is the one we're determined to fix, and that's what John will set out in more detail tomorrow. Alan Smith from Bauer.
Thank you, First Minister. On the issue of schools, we're hearing more about the concerns of teachers ahead of schools reopening this week. Many say they've not been given enough information or time to prepare. One teaching union today has said 87% of its members feel anxious. I was just wondering if you share that anxiety and what can be said or done at this late stage to reassure them.
I'm not going to say I share a teacher's anxiety, because I'm not a teacher. I'm not going to be in a school this week teaching young people. So it would be wrong of me to try to pretend that I understand exactly how a teacher feels. But I understand it in the sense it's not surprising to me that teachers and pupils and their parents will feel a sense of anxiety this week, because school has not been, some teachers will have been helping to keep hubs open over the course of lockdown, but for the vast majority of pupils, parents and teachers, there has been no normal schooling now for almost a 5-month period. So going back, given the circumstances we've all lived through, is not going to be an anxiety-free experience for anyone. And we will continue, so we continue to talk to teachers' unions about additional steps we might be able to take to reassure teachers as time goes on. But the guidance we have put in place for the start of the school term has been very carefully worked through and informed by scientific advice. And when I was in West Calder High School this morning, I was extremely impressed by a range of things, by the very basic arrangements they have in place from welcoming pupils back, checking their well-being, to the flow through the school to make sure that that's safe, to staggered lunch breaks, clear signage everywhere, including to help teachers keep physical distance from each other and from pupils, through to the use of technology to facilitate the new way of working in school, but also to support any young person who may be off school if they have symptoms of COVID and are self-isolating. So we will continue to work with and support teachers to feel confident as they go back in the arrangements that are in place. We'll make sure there is surveillance in place, and if there are other things that teachers say to us would help build that assurance, we will not rule that out. We will continue to consider that carefully. Overall, the importance of getting young people back to education, I think, can't be overstated. Schools have worked really hard to support pupils through lockdown, but we know impact on education, on well-being, on happiness has been negative for young people. So to get them back into full-time education has to be a priority. And final word, Gregor may want to say a word about the guidance in place and how we've come to these assessments. we're not complacent about this, and we will, I hope you get the sense from listening to me every day, if you do, I am not complacent about any aspect of COVID. But we do know that of all of the cases, the 19,000 or so cases that we've now had in Scotland, less than 1% of those have been in the under 15 age group, and around 2% have been in the under 20 age group. We also know from the evidence so far that younger people who do get COVID have a milder form of the illness. So that gives us some assurance, but as I say, we're not complacent, and we'll continue to do everything that needs to be done to build the confidence of parents, pupils and teachers. And never forget that teachers are often parents too, with families of their own, so their concerns are about their own wider network, and we take these really seriously. Gregor, do you want to say a bit more about the guidance? Yeah, of course. So this is guidance which has been carefully thought through, worked up by our scientific advisory group on education and children's issues. It's a group which comprise both public health experts, but also experts in education and on children's issues as well. They've been examining evidence not only from our experience in this country, but actually from around the globe, drawing on centres of expertise such as the European Centre for Disease Control and some of the learning that they have from other European countries, which helps to guide the return of children into education. The guidance that has been produced is very comprehensive. It draws on this wide evidence base which is now available. And as the First Minister has already outlined, we know from our experience, as I say, particularly in this country, that COVID-19 certainly tends to be a much less severe illness in children, in fact a very mild illness in children, which is appears to be less easily spread, and it's less easily transmissible between children as well. So using that plus other evidence bases, both in relation to the reflection of what the wider community prevalence rates are as well, the group is very confident that the guidance supports the safe return of children into education in this country. Thanks. Fraser Nicholl from Original 106.
Thank you, First Minister. Good afternoon. As you said there have been 231 cases in the Grampian area in just over 2 weeks, with 157 in some way linked to the cluster in Aberdeen. Are you able to tell us the background of the other cases that have been identified in the Health Board area? And given not all of these cases will be in Aberdeen City, how likely is an extension of lockdown into Aberdeenshire at this stage?
CMO may want to say a word more about this. The 70 or so cases that we've seen in Aberdeen over the last few weeks that are not thought to be part of this cluster. I can't give you all the detail on them right now because they are still being looked at, but they are closely being looked at so that we understand whether there are any patterns there that causes any additional concern, and we'll obviously update if necessary on that. The issue of Aberdeenshire is one that has been under review on an ongoing basis by the incident management team. Their view at the moment is that there is no need to extend restrictions into Aberdeenshire, but if they change their view of that based on what they are learning about the outbreak or how the outbreak develops, then of course we will not hesitate to take appropriate decisions, but they have not at this stage come to the conclusion that that is necessary. Hopefully, and we can never be sure that there won't be wider transmission or transmission out of Aberdeen City here. But the more the restrictions that we have put in place are complied with, then the more we can minimise, I hope, any wider spread of this. And that's what fundamentally the point of these restrictions are.
I'm sure it won't come as a surprise to you that myself and members of my team were in regular dialogue with clinicians in Aberdeen and in Public Health Scotland over the course of the weekend, as we kept a very careful and watchful eye on the figures that were emerging each day. And there's further analysis that has still to be done in relation to some of these cases. But the reports that I'm getting back from the incident management team and the clinicians in Aberdeen in relation to that are that at this point in time, they do not believe that there is evidence of sustained community transmission in either Aberdeen City or in the wider Shire at this moment as well. Clearly it's an area that we need to continue to keep a very close eye on, and we'll remain vigilant over the next few days just to see exactly what cases gradually can appear each day. The incident management team are meeting again today, and I expect a full report from them after that, where they'll give me a further assessment of today's cases too.
Thanks. Fraser Knight from Global.
Thank you, First Minister. You say you're hoping to build on the trust of parents ahead of schools returning this week. And we've heard from some who are still sceptical about sending their kids back. I was just wondering, you're expecting a full return to school by this time next week. For parents who perhaps are still unsure and they choose not to send their children to school, will they be judged or penalised? And I was just wondering, particularly for parents who perhaps have been shielding up until just a couple of weeks ago, is there any extra guidance or support for them? And is there any guarantee that if a child picks up coronavirus at school, that they won't bring that home to their parents?
Again, I'll ask Gregor to maybe say a word or two about people who have been in the shielding category. I do not want anybody to see this, particularly over these early days, as some kind of adversarial standoff between parents and government or parents and school. We all want to build confidence in a safe return to school. What I would say to parents, I'm not a parent, I'm a bit hesitant about giving advice to parents, but I would say engage with your school, take advantage of the arrangements that I know a lot of schools are putting in place for induction days, to understand the systems that are being put in place and the steps that are being taken to keep your children safe, and ask whatever questions you've got, and let's build that confidence and be assured, even if me simply saying this doesn't take away all your concerns. I don't expect that it would, but be assured that we are taking these decisions very seriously and informing them with the best understanding we have of the risks of this virus amongst younger people, the relative risks of transmission, and also the steps that we consider are most appropriate and necessary to minimise any risks within schools. So I would encourage parents to engage as much as possible with your children's schools. I'm sure most of you have been doing that anyway. I've got young relatives. My niece and nephew will be returning to school over the course of this week. So I see in my own family that excitement about going back to school and getting kids back to school, because I think all of us want to see that, coupled with that anxiety that comes from living in a pandemic and having had children out of school for so long. I think there's a degree of inevitability about that, but hopefully by the end of this week and certainly into next week, that confidence amongst parents and young people and teachers will have grown, because they will be dealing with the reality of it rather than perhaps the concern in the abstract. Gregor.
You'll recall that during July, the Royal College of Paediatrics and Children and Young People produced very comprehensive guidance that was a reappraisal of the requirement to shield for children and young people. And as a consequence of that, we were able to initiate conversations between those children and young people and their supervising clinicians to establish whether there was an ongoing need to shield, should that be a national recommendation, or whether there were specific tailored requirements for each one of those individuals that could be individualised in terms of their care plan when they went back to school. So those conversations should have been taking place over the course of July, so that each child, as they're going back to school, should be reassured that they know exactly the types of measures that they should be undertaking to make sure that they minimise and reduce the risk. But as I said before, the risk in relation to children and young people really allows us to reassess the requirement to shield as a consequence of some of this work that the college and others have done.
Thanks. Craig Payton from PA.
Thank you, First Minister. With reports over the weekend that the Prime Minister plans to come to Scotland for a 2-week holiday at the weekend, do you think that could encourage others from England to support the Scottish tourism industry and do the same? But is there also a worry that this could cause a spike in coronavirus cases in what will be primarily rural areas? And secondly, are you confident that the measures that John Swinney will announce tomorrow on exam results will be sufficient to ensure there isn't enough support for a vote of no confidence in him?
I can't make decisions on the part of the opposition. I speak for the government, and in government we are determined to focus on the issue, the substance of the issue, and trying to get this right for young people. And opposition parties, of course, will make their own decisions. But I would, suggest that everybody listens to what John Swinney has to say tomorrow, and then draw conclusions from that, as opposed to making their minds up, perhaps in advance of that. Look, whether it's the Prime Minister or anybody else coming to Scotland, I can't wait till we get to the day where I'm, sort of saying everybody come to Scotland and holiday, because we're out or over the worst of this virus. Right now, we need to encourage everybody, whether they are visiting Scotland or living in Scotland, to take great care. So, whether it's the Prime Minister or anybody else, when you're in Scotland, and, you should hopefully be doing this wherever you live as well, just abide by all of the advice, abide by the facts campaign, and minimise any risk of this virus spreading. And, if we all do that, wherever we are, then we've got the best chance of keeping it under control. And the only other thing I can say to the Prime Minister, I'm slightly envious he's getting to holiday in Scotland, but I hope the weather stays reasonably good for him, although I cannot promise that and refuse to take any responsibility for it. Chris Musson from The Sun.
Hi, First Minister. Just on Boris's staycation to Scotland, I'm not suggesting you should double up with him, but will you be taking a holiday or a staycation yourself at any point? And will you be seeing the Queen at Balmoral this year, because we're told the Prime Minister won't be? And if I may, on exams, just a point, you said the burden has not fallen equally across society. Now, this is in sharp contrast to John Swinney last week. He argued the direct opposite, saying there is no evidence that young people in deprived communities have been disadvantaged. So just on that very stark contradiction, does this not show that politicians, yourself included, will essentially argue anything if it suits them on the day?
I'll come back to that, because it's not an unfair question, and I hope people who watch me every day will reach a different conclusion, though, because this is not a normal time for politics, and actually it's more important that we are able to admit when we don't get things absolutely right than it is to try to stick rigidly to a position because we're scared of changing our minds, because journalists like you, Chris, entirely legitimately will remind us of the things we said before. So I'll come back to that perhaps in a second. In relation to the Prime Minister's holiday, I'm very glad to hear you're not suggesting we double up. I think his partner would probably take a dim view of that, as everybody else, and I'm going to stop this particular line of chat at the moment. I don't have any plans for a holiday at the moment. I'm pretty fully occupied on what we're dealing with right now. Obviously, our parliamentary recess times are different to the House of Commons as well, so Parliament goes back tomorrow, earlier than normal in the summer, so I think I'll probably have enough to occupy myself. I, at this point, have no plans to see the Queen at Balmoral. I usually would during September, but obviously we're not in a normal year. But if that changes at any point, then we'll see. But at the moment, given all of the restrictions, that's not something that is currently planned. And just to come back finally to your last point, in terms of the point that not just John Swinney, I made last week, is one actually that I think remains the case, which is that we have an educational attainment gap. We see that in the exam results every year. It's one we've been working hard to try to overcome. And the point that we made is that the system this year didn't create that gap. It's simply because we moderated teacher assessments that suggested a higher pass rate. We didn't initially take that opportunity to overcome that attainment gap, because we thought, and I suspect people will still make this argument to us, that wouldn't have been a legitimate way to do it. But and I know John feels the same, I have listened intently to young people over the last few days. I've read the letters and the emails that they have sent me, and I want to assure young people that I will continue to do that. And the thing that most troubles me, and over the weekend, my conclusion was we couldn't let this stand, is rightly or wrongly, whichever view of that you take, I can't, and I'm not having a situation as a legacy of this year's process and as a legacy of the invidious decisions we've all had to take over COVID, being that a young person from the kind of communities I grew up in concluding that it doesn't matter how hard they work at school, there's no point because the system is against them. Because that actually, for me, having had the few days to properly think about this and listen to this, that is, I think, a bigger problem than any suggestion that, well, maybe this year's pass rate is a bit higher than it would have been if there are exams. And I've come to that conclusion, a lot of soul searching and a lot of listening to young people. And I'm prepared to say that that's different to the judgment I initially made, because I think when things are so important, it's important that somebody like me and John can stand and say, we didn't get this right the first time and we're going to put it right in the future. And that comes not just from the last few days, but my experience from when I was at school and the opportunities I got. And I don't want any young person to think that education is not a route out of poverty or disadvantage for them. And I don't want that to be the lesson any young person takes from this year's results. And I feel that very, very strongly. And that's why I'm determined, as is John, that we put this right. Michael Blackley from the Daily Mail.
Thank you, First Minister. You seem to be quite surprised by the number of people that have had these significant downgrades in their exam results. And I'd just like to ask why that is the case. What modelling did you do in advance of this, and how many people did you think would suffer these kind of downgrades? And also in terms of the SQA, they refused to provide the methodology they were using in advance. Do you think they were wrong to do that? And why didn't you intervene and force them to do that?
The SQA, as I understand it, the Chief Executive will appear before the Education Committee of the Parliament this week, and will speak from the perspective of the SQA. We couldn't have known in advance exactly what the results would show. The results, as we know, did deliver an increase in the pass rate and a slight narrowing of the attainment gap. And the reason for the moderation, and people I know across the political spectrum and out with the political spectrum will have, views about the SQA and moans about the SQA. I absolve the SQA of the responsibility for this. The ministers asked the SQA to apply an approach that delivered a set of results that were comparable in terms of quality to last year's. This is a view that ministers are taking now that didn't take enough account of the individual circumstances. And I've just set out, so I'm not going to repeat it to Chris, some of what has driven that. And I make no bones about that. When you change, or when you come to a conclusion that despite your best intentions, the impact of what happened is not the one you want or are prepared to live with, then sometimes it's harder for somebody like me to stand up and say we got it wrong than it is just to keep making the same arguments and hope, as it inevitably does, the media attention moves on. It's much better, particularly on such an important issue, to say we didn't get this absolutely right and we're going to fix it, and that's the position we're in. Gina Davidson from The Scotsman.
Hi, thanks, First Minister. A couple of questions on the exams. You've said that it's not up to the kids or the schools to put in the appeals. Does that mean now that teachers don't have to work up the appeal process? They don't have to start digging out the evidence and providing that to the SQA? And also, if you have absolved the SQA of this, if it's not their fault, then is the fault surely then with the minister, and they were acting on his instructions, your instructions? You have confidence in John Swinney, I'm quite sure you do, because he's a long-term colleague, but how can the pupils and the parents and the teachers continue to have confidence in him if this is not an SQA problem of the government's making?
So on the first point, John will set out the details tomorrow, and I think I've probably gone as far as I can go today without getting into a position where I'm disrespecting our obligation to set this out to Parliament. Look, I absolutely understand the importance of accountability. I'm an elected politician, and the public will get regular opportunities to decide whether they have confidence in me and my government or not. In fact, there'll be an opportunity in the not too distant future for that. And that's really important. What I would say, and I don't say this to try to absolve anybody here, we got something wrong and we're going to try and put it right. I suppose the point I'm making, and I actually think from my interactions with the public over the past 5 months, which of course have been from a distance, I think the public have much more of an understanding than perhaps we politicians sometimes do. We are in unprecedented situations right now. This was not a normal academic year. Our schools had to close. Young people couldn't sit exams. So we were faced with having to have an alternative way of awarding qualifications. There were no easy options around this. None of us wanted to be in this position. And we tried to take an approach that, on balance, we thought was the right one for the credibility of the system overall, with an appeals process that allowed individuals who felt they hadn't been fairly awarded to seek to have that rectified. And we took that decision with the best of intentions. And I would repeat again, it's the same approach that has been taken in England and Wales by governments of different political colours. We're all grappling with the same issues here. Having seen the impact of that on individuals for reasons I have spoken about, and the worry that raises in my mind, particularly from young people from more deprived communities, then I don't think we can let that stand, and that's why we're going to fix it. But the point I'm making, and people can make their own judgments about this, sometimes in life when we're all dealing with really difficult circumstances, it maybe just doesn't come down to fault. We're trying to make the best decisions we can. And I'm also trying to lead a government right now that is prepared to acknowledge when we don't get things right, because none of us have lived through a pandemic before. We've not had to take these decisions. And I fervently hope that whoever might be in my office in years to come, I hope no First Minister ever has to take some of the decisions that I and my government have had to take over these past 5 months, because they have been really horrendous. And I hope we've got most of them right, but we have not got all of them right. And this is one where, despite our best intentions, we didn't get right. But that's not because we didn't try or because ministers didn't pay enough attention to it. We're grappling with really difficult issues right now. And that's why it's important when we don't get it right first time, we are big enough and able to acknowledge that and put it right. And that's what we are intent on doing. Tom Martin from the Daily Express.
Hi, thank you, First Minister. Could I just briefly follow up on the point Chris from The Sun was asking about, just in terms of, you and Mr. Swinney spent the best part of last week defending this system. Your critics will suspect the timing of this change of heart will have a lot to do with the vote of confidence or the risk of a ballot box backlash next May. What do you say to that?
Critics will believe what they want, and that is fine. Opposition parties, if I was in opposition, then no doubt I'd want to believe the worst of the government as well. We're not in normal times. We are. I and John, we have really agonised about this over the last few days. We set out last week, as you would have expected us to do, as I still have today, the reasons why we took the decisions and tried to develop an understanding. There weren't decisions that were just taken, willy-nilly with no thought. We wanted to have a set of results that was credible, so that individual young people could know that their qualification was as worth the same this year as it was as it would have been in any other year. So I've tried to set out the reasons why we reached those decisions, which, as I say, are actually the same decisions that other governments across the UK have reached. But listening to how that has impacted on individuals, for the reasons I have set out, I have been so struck in the last few days about young people and a tone from young people that seems to sound as if they think the system, whatever they do, is stacked against them. And I can understand why they think that. It was not the intention. But if that is how some young people feel this year, then it's wrong for them. But also, I don't want that being what next year's young people think, or the year after that. So that really is what I want to put right. And, you know, when we do, and I'm not going into more of the detail, I'm pretty sure in the normal, legitimate way of democratic and media scrutiny, some of the concerns we had about not having a system of moderation, I will have people like you putting to me then. So these are not black and white decisions, but fundamentally, young people in this country feeling that when they work hard at school, they can overcome disadvantage is the most important thing of all to me. And I'm not prepared, even although we didn't intend it, to have an outcome this year that puts that in jeopardy, because the long-term price of that would be too high. So that fundamentally is the decision that we've reached. Alistair Grant from the Herald.
Hi there, First Minister. Just to touch on something you said there, you mentioned concerns around not having a system of moderation. You've previously said that the teacher estimates for pupils were not credible because, for example, they would have seen the pass rate for the most deprived pupils increase by 20% in a single year. Is that still your position, that those teacher estimates are not credible and that some form of moderation was and is necessary? Or tomorrow are we going to see moderation done away with? And if I could just ask as well, young people who are obviously waiting for university or college places have been told that they'll receive appeal results on September 4th. Do those dates still stand? And for those pupils that are considered non-priority who aren't waiting in those university places, is there any further clarity on when they'll get their appeal results?
I'm not going to get into more of the detail for reasons I've set out, that John Swinney will set out tomorrow, and all of those questions will be answered in that statement tomorrow. On the first part of your question, what I said last week, I didn't say teacher assessments are not credible. I said an overall outcome that led to a 20-point increase in the pass rate, and that, when I used those numbers last week, I was talking about the bottom 20% in terms of deprivation. That I didn't think that outcome would be seen as credible, and you know, I'm pretty sure there will be people who would make that argument, would have made it last week and will continue to make it. But what I'm saying now is I think whatever the view of that is, in my mind, now a bigger problem is leaving an impression with young people that it doesn't matter how hard they work at school, some algorithm is going to get in their way. And I am not prepared to have that. And that is why we will set out the alternative approach that John will set out tomorrow. I do think, and I think I said this on one occasion last week, that the more fundamental question that arises in my mind out of this is, again, to use the 20% most deprived cohort, you know, is it the 65% pass rate that we, or thereabouts, that we normally get in an exam type year, or is it the 85% teacher assessment that is the best way of assessing the performance of young people? And I think that is something that we need to look at and consider as we continue to try to close that attainment gap. But obviously our first priority is to sort this for young people who had the results this year. Adele Merson from the P&J.
Good afternoon, First Minister. Judging by the daily figures so far, there does not appear to have been a corresponding increase of patients in Grampian requiring hospitalisation. Are most positive cases in this cluster presenting with only mild symptoms? And if so, what do you put this down to? Is it the young age of the individuals affected?
Gregor and or Jeane may want to say more about this. I suppose the two things I would say are, we do know that overall, as well as in Aberdeen, there is a younger age profile to cases at the moment, which may be that link between hospitality and people meeting up with friends. So that may be a factor. But I suppose the second point I'd want to make, which is just to guard against any early conclusions, we know from past experience that there is a lag between cases and people who become unwell, being admitted to hospital or ICU, and unfortunately dying. So I hope we don't see an increase in hospitalisation in Aberdeen over the next period. But obviously one of the reasons why we are so determined to keep this virus under control is that we do know that for some people it can have really serious consequences, and so we should not get complacent about that. Jeane, do you want to say anything?
I'd just add one other point to that. I think that what the situation in Aberdeen that we're seeing, and as it evolves we will see in more detail, also reinforces is even where individuals have mild symptoms, not only is there the lag that the First Minister has just reminded us of, there's also the real importance that if you are contacted by our Test and Protect team and have no symptoms or very mild symptoms, that you do what we ask you to do, that you isolate for those 14 days, because the risk always is that even where you may have no symptoms but be infectious or have mild symptoms, that you could pass that on unintentionally, but to someone who is more vulnerable to the virus having a greater impact on their health than it is having on yours. So the whole process of Test and Protect and following that guidance is really important, because that's how we protect those who are more vulnerable to the disease having a very serious impact on them, and we break the chain of transmission.
Gregor.
So I've been in regular dialogue with the NHS Grampian Medical Director just on a daily basis to see exactly where hospital admissions are in relation to COVID-19. And at this point in time, we're not seeing a signal coming through from people involved with this outbreak at all. Now, as I say, that shouldn't surprise us given the early stages here. We know from experience that it's certainly into the second week and sometimes beyond that, that we're generally seeing people becoming ill enough to require hospital treatment and hospital admission. So it's something that we continue to keep quite a close eye on. The majority of people that we are picking up through the testing just now who are positive have been symptomatic. There's a whole range of symptoms that people have been displaying within that at all. We will continue to monitor them. But just as the Cabinet Secretary for Health has said, it is really, really important that we don't become complacent in this. People who are identified as having the requirement to isolate must please adhere to that guidance. We know that we will reduce the chances of this being spread to other people if people isolate in their own homes, that they don't take these symptoms for granted, that they stay to themselves, so that we're not passing this virus on to other people. Generally, what we will see is if the younger age groups primarily are being affected by this, they are less likely to require hospital admission. But again, the point I want to emphasise here is we cannot take anything for granted. Our experience over the earlier part of this year still show that people in younger age groups can sometimes become very ill, necessitating hospital treatment because of COVID-19. So although there's a strong signal coming through that it's generally younger people who are being affected by the virus in this outbreak just now, we cannot take for granted that that won't translate through to hospital admissions at some point.
And the final question today is from Daniel Sanderson at The Telegraph.
Thanks very much, First Minister. The change in position on school exams will obviously be welcome to the people who saw their results downgraded, but there was a smaller but not insignificant number of people, I think about 9,000 awards, that were actually moderated upwards following the SQA moderation process. I understand you don't want to say too much, but obviously people in that group might be worried that they're about to get a lower grade than they got last week if you were to just go on teacher judgment. So can you offer any reassurance to them? Can you offer a guarantee that that won't happen? And also, could I please just ask a question to Dr. Smith on a separate question, separate subject? On church services, obviously the rules are still quite restrictive compared to pubs and restaurants. I just wonder if you could say a bit more about the thinking behind that and whether the advice might change at any point. Thank you.
To Gregor in a second. I do want to take the opportunity just to allay any concerns that any young person in that position might be in. We are not going to do anything that takes away a grade you got last week, and I don't want anybody, the small number of people who are in that position, having to worry about that even for 24 hours. So let me be categoric about that. Gregor.
There's a variety of things that we need to take into account when we're thinking about places of worship in general and the risks that are associated with those. So some of that is specific to the location itself, the venue, the fact that these are indoor venues, the fact that sometimes they can be cooler, there are a range of environmental considerations, the greater number of surfaces that are around about people, sometimes the close proximity within which people would mix in those environments. all place people at a higher risk, and probably not the least of those is the way that people project their voices and sing within that environment as well. So that is all factored into how we judge the overall risk in these places, and we continue to keep it under review. We need to make sure that the particular characteristics in relation to the demographics of people who might visit these places as well are all taken into consideration. And over time, as we're assessing what the general transmission rates are across communities, it is entirely possible that we'll begin to change some of the guidance that relates to these places as well.
Thanks. That concludes the questions for today. So thanks to the journalists, to Gregor and to Jeane, and to Jill, our BSL interpreter, and thanks to all of you for joining us. I'll be back tomorrow at 12:15. John Swinney will make a statement in Parliament about the SQA results tomorrow afternoon. If you are a young person or parent or any member of the public who's interested in hearing the detail of that. In the meantime, can I just close with the usual appeal to all of you to abide by the facts advice. Face coverings, avoid crowded places, clean your hands and hard surfaces regularly, keep 2 metres distance, and self-isolate and book a test if you have any of the symptoms of COVID. And with that, I will take my leave, we will take our leave, and we will see you again tomorrow.